Would like to invite uh, Hirangi, Dr. Hirangi Madhavan.
Hello. Yes, my name is Hirangi Madhavan. I'm a student at Data Institute of Social Sciences. I've done my master's from Arizona State University, and I've done my undergrad for University of California, Los Angeles. And so let me go ahead and present my topic. So I'm going to be looking at the gender differences in mental health outcomes among elderly widows using the LASI dataset. Um, and as my previous presenter has gone over uh, this topic as well, I'm just going to quickly go through the background and then I'll get into the research. So as discussed, there's of course a rise in population of individuals that are over the age of 65. This number, not just in India, but globally will increase to about 16% in 2050. With this growth of adults, especially the elderly, we're going to see a rise of widowed population, particularly among women who tend to outlive men, particularly due to their longer life expectancy, as well as marrying older men. Um, and so in India, particularly, we have about 32 million individuals who are widowed. 24% of those are women and 7% are men. And this is based on the census data of 2011. So as you can imagine, those numbers have only increased in the last decade. So widowhood for women, it has societal, psychological, and economic consequences. Patriarchal norms in India tend to marginalize. They strip them of their social status, and they face exclusion from family, religious gatherings, and societal roles, which kind of compounds to something known as social death. Whereas widowed men also do face different challenges. They may not face the same societal marginalization or exclusion, but they still experience emotional distress, depression, cognitive decline, and loneliness. And so it's important and imperative to understand the gender differences and how both of these genders actually experience the phenomena of widowhood. So for this particular research, we utilized a multi-level approach to examine variables such as gender, living situation, and social and religious activity levels that shape mental health outcomes. The first question was obviously to understand if there are differences between men and women. Of course, literature does suggest that women experience higher psychological distress due to economic dependence, social isolation, and restrictive gender roles. The other component was to understand the moderating effects of living situations on gender. So whether family members mitigate the impact of widowhood. Of course, study has shown that social isolation and isolation in general does have negative impact on psychosocial effects of widowhood. But it's also interesting to understand if co-residence or cohabitance does play as a buffering effect or not. And then, of course, other factors looking at age and education, as well as social engagement. Social engagement was qualified as religious or social gatherings. And then also understanding if urban or rural settings play an important role in shaping mental health disparities. So as stated, we've used the LASI data set. So the data set was actually stratified using marital status. So only widowed individuals were looked at. This included men and women both. And then from that, we looked at men in a separate category as well as women. And of course, if the individual did not respond to the psychosocial aspect of the data, they were excluded from the sample. I'd also like to highlight that the psychosocial scale was from 10 questions, of which only 7 were used, and the 3 were excluded after testing for Crohn's alpha and reliability. So the variables of interest were psychological outcomes, which was a composite score from the psychosocial questions, with higher scores indicating worse psychological well-being. Gender, male and female, the differences in mental health health outcomes were a key focus, with a large population, as you can see from the charts, being women, and then also urban and rural settings, with again the larger population being rural settings. The other aspect that we looked at was social and religious activities. So this was the total level of participation in communal and religious activities. And that was proven to be, that should have been as a buffering effect towards mental health challenges. And those activities were summed based on the number of times they participated in either weekly or yearly religious or social activities. In terms of the control variables, we used education, living situation, and the regional setting as a control variable.
Time. Please stick to the time limit. Can you fasten it a bit?
Sure. Sorry about
We
that.
can do slides. We can directly go to the results, I guess.
Yes. Let me just go ahead and go to the results. So what we found is that gender was obviously a strong predicator of mental health outcomes. Females had higher, worse psychological well-being. And the other interesting aspect was that the living situation actually did not have any significant impact on the psychological well-being, nor did it interact with gender. And that's contradictory to previous research, which found that co-residence with family or children would play as a buffering effect. Obviously, age actually played as a significant factor regardless of gender. So the older the individual was, they had worse psychosocial outcome versus gender, females were worse, living situation had no impact, and age for both of the genders played as a component. And in this particular setting, gender differences in terms of age, education, rural status did not matter, which means that whether men or women, they both had the same worse outcome in psychosocial in terms of education, rural status. So I'm just going to quickly talk about why this is more important. First of all, the contrary to expectations living situation, whether they lived with family or alone, is still to be further explored. Since this was based on quantitative LASI data, we were not able to go and probe further into living situation. Now, living situation could have been beneficial or it could have been harmful to the individuals, but overall, the living situation played no role in their psychosocial outcome. And the other aspect was the religious or social activities. Anyway, they had a lower, widowed individuals had lower engagement in social or religious activities. And so this did not play as a protective factor either. So this also highlights a need for interventions, whether we need to provide interventions that increase their social and religious activities, or look more further deeper into this. So again, one of the biggest limitations is this cross-sectional design. We cannot infer causality from these results. And the biggest point is that qualitative studies are needed to further probe into this data, whether you look at social activities and religious activities, or whether you look at cohabitants, there is a need to provide more in-depth studies that look at specific regions, whether it's urban or rural settings. And so I think overall, as my previous presenter, and I've also presented, that there is a need to look further into widowhood itself as a phenomena. And it's specifically more important to provide qualitative studies that do the same. So I'll just wrap up there. Thank you.
Thanks, Ms. Hirangi, for such an interesting talk.